Imagine this. You are 63. You wake up, reach for your phone before you even reach for your partner. And the first number you see feels like it sums up your whole body. 20%. Battery low. You are not sick, you are just flat. No real drive to get out of bed, no real desire, even when the opportunity is right there next to you. You tell yourself, well, that is getting older. But what if part of the problem is not your age at all? It is your light. More specifically, the lack of the right light at the right time. Because here is what very few men over 60 are ever told. The first 15 minutes of light your eyes and skin see each morning can quietly shape your testosterone, your sleep, and even your sex drive for the rest of the day, not with some expensive red light gadget. With the most old-fashioned tool there is, the sun. And today, as your sexual health doctor, the plan is simple. Show exactly how to use a 15-minute morning light ritual, a short realistic sunlight routine to support testosterone, improve sleep, and gently wake desire back up in men over 60 minutes. No gimmicks, no fake promises. Just early evidence, real physiology, and a ritual you can actually live with. How morning light talks to your hormones. Let us start with what that magic 15 minutes is actually doing inside you. When light hits the cells in the back of your eyes, first thing in the morning, it sends a powerful signal to your brain. Day has started. Time to switch from night mode to day mode. That one signal sets off a chain reaction. It shuts down melatonin, the hormone that keeps you sleepy and dull. It triggers a healthy rise in cortisol, not the stress spike you get from emails at midnight, but the natural morning pulse that helps you feel awake and focused. It anchors your internal clock so your body knows when to release melatonin again at night, improving sleep quality. Better sleep in turn is directly tied to healthier testosterone rhythms and better sexual function in older men. On top of that, there's early but intriguing research showing that light itself can nudge the hormone systems that support testosterone and libido. In one small study at the University of California, San Diego, healthy men exposed to bright light about 1,000 lux, similar to an overcast outdoor morning from 5 to 6 a.m. for 5 days, had an almost 70% increase in a pituitary hormone that stimulates testosterone production, compared with a dim light condition. In another pilot trial from Italy, men with low sexual desire who sat in front of a very bright light box around 10000 lux for 30 minutes each early morning for 2 weeks tripled their sexual satisfaction scores and saw testosterone levels jump from about 2.1 to 3.6 nanograms per milliliter, while a dim light group showed almost no change. These were small studies, not giant definitive trials, and many involved younger or middle-aged men, not only men over 60. But together they strongly suggest something simple and powerful. Bright morning light can stimulate the brain regions that control reproductive hormones, and in some men, measurably increase testosterone and sexual desire. You do not need to chase fancy red light devices to get those benefits. You can mimic the core effect by giving your eyes and skin real outdoor light consistently at the right time of day. Sunlight, testosterone, and desire, what we actually know. Before we build your ritual, it is worth being clear about what is known and what is hype. Bright light therapy in the morning has been shown in small clinical studies to increase sexual satisfaction and raise testosterone in men with low libido compared to placebo-level light. A classic experiment found that early morning bright light exposure boosted levels of luteinizing hormone, the pituitary signal that tells your testes to make more testosterone, by nearly 70% in healthy men. Reviews and popular summaries aimed at men's health point out that light therapy seems especially promising for men whose low sex drive varies with seasons, or who feel much lower in darker months. UV-containing sunlight on skin for 20 to 30 minutes a few times per week has been associated with higher sex steroid levels, including total testosterone, and may contribute to the seasonal pattern where men's T tends to be higher in not T tends to be higher in not T. Sunnier months. Morning sunlight exposure, especially before 10 a.m., improves circadian alignment and sleep quality, and better sleep is strongly linked to healthier testosterone and libido in older men. At the same time, many of these studies are small, short-term, and not all in men over 60. Light is not a replacement for testosterone therapy in men with proven severe deficiency, nor is it a magic cure for every type of low libido. So the honest take is this. Morning light is a low-risk science-supported lever that can improve sleep, support a healthier hormone rhythm, boost mood, and in some men measurably increase testosterone and desire. Think of it not as a testosterone hack, but as one of the basic conditions your body expects if you want your hormones and libido to work properly in your 60 seconds and beyond. Turning red light hype into a 15-minute sunlight ritual. You have probably seen biohackers online aiming red lamps at their groin claiming to triple testosterone. Yes, some animal work suggests that light on the torso or testes might influence sex hormone production, but human data there is very limited and far from conclusive. The good news is you do not need to do anything that extreme. Those Italian and UCSD studies we just talked about did not shine light on testicles, they shined bright light into the eyes, the natural way your brain senses time and sets hormone rhythms. And you do not need a medical-grade light box to get a useful signal. Real outdoor daylight, even on a cloudy day, usually delivers far more brightness than indoor lighting. So let us translate all this into a simple, realistic 15-minute morning light ritual for men over 60 that works with regular sunlight, doubles as a gentle morning walk, and fits into a normal life, not a laboratory. The 15-minute morning light ritual step by step. Think of this as your daily hormone and desire reset using nothing more exotic than the sky. Step 1. Get outside within 60 minutes of waking. Once you are up and have had a quick glass of water, your goal is to be outside, not behind glass, within the first hour of your day. Glass filters some of the wavelengths and dramatically reduces overall brightness compared to direct outdoor light, which weakens the signal to your brain. If you can manage within the first 30 minutes, even better. Step 2. Give your eyes real daylight, no sunglasses at first. For this ritual, your eyes, not your skin, are the primary sensors. You do not stare at the sun, that is dangerous. You let natural daylight enter your eyes from the environment while you look around normally. Avoid sunglasses for at least the first 10 to 15 minutes unless you have a specific eye condition or medical advice that requires them. Darker lenses block exactly the light your brain is trying to detect to set your circadian and hormonal rhythm. Step 3. Walk for 10 to 15 minutes at a gentle pace. Use this time to move your body. You are not trying to break a sweat. You are telling your system, the day has started, light is up, muscles are working, blood is moving. That combination of light plus movement further supports healthy cortisol and later melatonin timing, which together support better sleep and hormone balance. If you can only walk slowly, that is fine. The ritual is about consistency, not speed. Step 4. Expose some skin a few times a week safely. For testosterone and sex steroids specifically, there is growing evidence that direct sunlight on skin, especially arms and legs, 20 to 30 minutes a few times per week, can raise sex hormone levels in men, particularly when UVB is present. One study described men who got 20 to 30 minutes of midday sun on their torso and limbs 2 to 3 times a week having notably higher testosterone levels than before, helping explain why men's T levels often peak in sunnier months. So 2 to 3 days a week when weather and skin cancer risk allow, do your 15-minute morning walk with short sleeves, or even shorts if appropriate. Avoid burning, especially if you have light skin or a history of skin cancer, and respect your personal dermatology advice, but do not hide from the sun completely unless you must. Step 5. Stack a desire-friendly mindset onto the walk. Remember, libido is not just hormones, it is also mood and mindset. Light therapy studies show that bright light improve not just testosterone but mood and sexual satisfaction in low-desire men. Use your walk to breathe deeply in through the nose, out through the mouth to lower stress. Think of one thing you are genuinely looking forward to that day. If you are partnered, consider sending a short, warm message later instead of only practical texts. You are using light to reset your brain and hormones and your thoughts to reset your relationship with desire. Together, they pull in the same direction. What kind of results are realistic? If you stick with this ritual, 15 minutes of outdoor morning light and gentle walking most days plus 2 to 3 short, safe midday exposures a week to arms and legs, what can you actually expect? Based on the research and clinical experience, sleep. Many people report falling asleep easier and waking less at night within 1 to 2 weeks because morning light is one of the strongest tools we have for aligning circadian rhythm and melatonin timing, mood, and energy. Bright light therapy is a well-recognized treatment for certain mood issues, and even in generally healthy men early morning, light tends to improve alertness, reduce grogginess, and support a better overall sense of well-being. Libido and satisfaction. In a small Italian trial, men with low sex drive who got 30 minutes of bright light first thing in the morning for 2 weeks reported sexual satisfaction scores about 3 times higher than before. The control group barely changed. Their testosterone levels also rose significantly while the placebo group did not. Your results may not be that dramatic, especially if you are older or have other health issues, but a gradual uptick in interest and satisfaction over weeks to months is a realistic goal. Testosterone. The early morning UCSD study saw about a 69% increase in luteinizing hormone, a testosterone-stimulating pituitary hormone, after a week of bright morning light compared to dim light. Bright light libido studies have documented testosterone rises of 50 to 70% in some men with low desire over 2 weeks of treatment. Long-term observational work suggests that men who regularly get sunlight on their skin have higher sex steroid levels and that sex hormones tend to be higher in sunnier months. For a man over 60, that does not mean you jump from low to teenage levels. It means nudging your system toward the top of your age-appropriate range instead of sliding down to the bottom. Desire and connection. When sleep quality, mood, hormone rhythm, and blood vessels all move in the right direction, desire often stops feeling like something you have to create and starts feeling more like something that shows up naturally again. Important safety notes and limits. Light is powerful medicine. Like any medicine, it has to be used wisely. Skin cancer risk. If you have a history of skin cancer or very high risk, discuss any increase in sun exposure with your dermatologist and favor short, non-burning exposures. You may lean more on bright but indirect morning light eyes rather than midday UV. Skin, eye conditions and medications. Certain eye diseases and drugs that make you more light sensitive may change how you use bright light. Always follow the advice of your eye specialist. Mental health. In people prone to bipolar disorder, intense light therapy can, in rare cases, trigger mood switches. If you have that history, talk to your psychiatrist before using any deliberate bright light regimen, not a standalone fix. If you have severe proven testosterone deficiency or complex sexual dysfunction, morning light will help your environment but may not be enough by itself. It should be combined with proper medical care, not used instead of it. Small early studies. Many of the eye-catching numbers, 70% testosterone increases tripled sex satisfaction, come from small, short trials in specific groups of men, not huge mixed-age populations. Treat them as proof of potential, not guaranteed outcomes. Your 30-day morning light challenge. Here is how to turn this from interesting video into a real-world test. For the next 30 days, go outside within 60 minutes of waking. Get 10 to 15 minutes of natural daylight on your eyes, no sunglasses if possible, while walking gently. Do this at least 5 days a week. On 2 to 3 of those days, expose your forearms and maybe calves for 15 to 20 minutes without burning. Keep a simple log: sleep quality poor, okay good, energy low medium high, desire low medium high, morning erections none, partial good. At the end of the month, do not just ask, did I triple my testosterone? Ask, do I fall asleep easier? Do I feel less wired and tired? Do I think about sex a little more often? Do I respond more readily when the opportunity is there? Do I wake up with even occasional morning erections I did not have before? If your answers move even one notch in the right direction, you have just learned something very important. Your body still responds. Your hormones are not done. And a simple 15-minute relationship with the morning sky can be part of bringing your desire back to life. If after 30 to 90 days of real effort you feel absolutely no change in energy, desire, sleep, or erections, that is not a failure. It is a signal to dig deeper with a knowledgeable clinician into your testosterone levels, cardiovascular health, medications, and mental health. Either way, you have not wasted your time. You have improved a fundamental pillar of health: circadian light exposure that supports far more than sex. Your heart, your brain, your metabolism, and your mood all benefit from it. So tomorrow morning when your alarm goes off and you feel the pull of the phone and the coffee machine, remember this: the most powerful part of your testosterone and desire ritual does not come in a capsule. It comes from opening your front door. Step outside. Look up. Walk. Let your brain and body know the day and your desire are still very much alive.